Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about the named signs that we see in chronic tonsillitis, and we see two signs over here. One is the Irwin-Moore sign and second is Wood's sign. We'll discuss each one of them in today's class. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. Now, what is Irwin-Moore sign? Now, this Irwin-Moore sign is actually a clinical sign that we elicit when we are examining the tonsillar fossa. Now, what is it exactly? What do we do here? What do we see here? When we apply pressure over the anterior pillar, which is the palatoglossal arch, we see that there is an expression of pus happening from the tonsillar crypts. This particular sign is what is known as Irwin-Moore sign. Now, this is particularly seen in a case of chronic tonsillitis. Now, what is the reason behind this? So basically, in chronic tonsillitis, the tonsillar crypts, they contain pus, debris, and this caseous material. So when you do the squeeze test, what is the squeeze test? Here, the examiner will apply gentle pressure over the anterior pillar. This gentle pressure ends up compressing the tonsil. So when you do the squeeze test, it will end up in pus or all the cheesy materials that are inside the tonsillar crypt come out, exude out of these crypt openings. This happens because why are all these pus debris happening inside? Because of chronic infection, the crypts get obstructed. So they end up retaining all of the pus. And now when you're applying pressure through the squeeze test, all of this pus and debris are expressing out. This particular sign was named after Irwin-Moore. That is why we know it as Irwin-Moore sign. Now, Irwin-Moore was the one who described this pus expression from the tonsillar crypts when we apply anterior pillar pressure in case of chronic tonsillitis. So this is the first eponym that we need to know in chronic tonsillitis. So the test we perform over here is the squeeze test. Can you also tell me some Viva questions over here? What is the most common node that is involved in chronic tonsillitis that we see to be enlarged? We see the jugulodigastric node. Can you tell me a named criteria that we follow when we are planning for tonsillectomy? That is the Paradise criteria. I have a separate video on Paradise criteria. You can check it out over there. Last question. Can you tell me the cardinal signs of chronic tonsillitis? This is a very, very important Viva question. So there are 3 such signs, and at least 2 of them have to be present to be able to diagnose as chronic tonsillitis. The first one is that there is flushing of anterior pillar. Second is Irwin-Moore sign positive. And third one is a persistent jugulodigastric lymphadenopathy, which is non-tender. So these are our 3 cardinal signs of chronic tonsillitis, and at least 2 of them have to be present for us to diagnose a case of chronic tonsillitis. So that's about Irwin-Moore sign. Let's move on to the second sign, which is known as the Wood sign. Now, what is Wood sign? Wood sign is a clinical sign again, which we are detecting when we palpate the neck lymph nodes. What is this? Wood sign is basically the palpable enlargement of the jugulodigastric lymph node that we see in cases of chronic tonsillitis. Again, this is also an eponym which is named after Wood, who described jugulodigastric lymphadenopathy as a marker of tonsillar pathology. So here we already know that the most common node or the sentinel node involved in case of tonsillitis is the jugulodigastric lymph node. So this is about the 2 named signs that we see in chronic tonsillitis. Very important for your Viva questions, and I hope this has helped you understand it. See you in my next class. Thank you.